All right, welcome. My name's Lieutenant Paul Delaney. We are going to be doing the American Heart Association Heart Saver CPR Adult, Child, and Infant CPR. That's what you'll be certified in. We are also going to do the Heimlich choking maneuver. So what we're going to do is watch a certain amount of videos, stop, and then we're going to practice what we learn on the video. So there's going to be some video, and then there's going to be hands-on training. So let me ask, how many people have had CPR before by raising your hand? All right, okay. How long ago have you guys had it? You do every year? Years ago. Okay, so Marie, for you, it's probably changed a lot. Okay, yeah. It's been over 10 years. It's changed then, yes. Yep. So, okay, we got the paperwork done. Heidi, I know you have 2 years ago, and Brandon, nothing changed since then. What's going to happen is you're going to get, I have the roster done. I have your email address, and I will enter them into the computer, and you will get your card emailed to you. Okay? So, and at the end of the class, I'll go over how they're emailed, because sometimes they get sent a spam email by mistake, but I'll go over that. All righty. So, I've been teaching CPR for over 25 years. I'm a 26-year member of the Wellesley Fire Department. I'm the public education officer. Not only do I do CPR first aid, I do everything from the little kids in school. Like tomorrow, I have a preschool coming to the fire station, and I do a lot of work all the way up to the seniors at the senior center. So it's something I enjoy doing is teaching. I try to make this course fun. I try to make learning CPR fun, because when your class is fun, you learn, okay? I know Heidi's had one of my classes. We try to make it fun. We're not just gonna, I'm not gonna stand up here and read out of a book or give you death by PowerPoint, all right? And any questions, just stop and say, hey, Paul, you can call me Paul, by the way. I got a question, or I teach so much, especially CPR, sometimes I go too fast. So you can say, Paul, just stop, slow down. And since I'm being videotaped, I don't know, my wife says I'm very loud. So she says I talk too loud. I don't know. I think it has something to do with my selective hearing. So, but we'll get through that. So, to start with, we're going to start off with the beginning. So we're going to watch a video on adult CPR. Then we're going to do a practical on it. We're going to teach you everything from mouth to mouth, but we're not really going to do mouth to mouth. I've got barriers here that we're going to put the barriers on, but my mannequins are so old that we're not, don't worry, we're just going to pretend we're doing it. I've got a grant in, hopefully I get, for all new state-of-the-art. The new mannequins are going to be what they call feedback mannequins. So they give you feedback. So they're expensive, so I've got a grant out for that. So my mannequins are pretty old, but they work. And you've gotten your Heart Saver book there. That's yours to keep. And so let's roll. I'm going to turn the lights off to run the video.
Sudden cardiac arrest occurs without warning or within just a few minutes after symptoms appear. The term heart attack is often mistakenly used to describe cardiac arrest. Although a heart attack may cause cardiac arrest and sudden death, the terms don't mean the same thing. Cardiac arrest occurs in both men and women, but for the purposes of this course, we will perform CPR on male victims. For the purposes of this video, actors may not always be shown wearing personal protective equipment. Products are shown for demonstration purposes only. The American Heart Association does not endorse or recommend any specific manufacturer or product.
Really want us to do well with this presentation tomorrow.
What do you think they'll do?
Well, I hope they'll hire us.
Well, based on your proposal, it'll be a great partnership. Hey, I'm buying. What do you like? Hey, Anthony!
I remember taking CPR at work, but what do I do first?
Maybe someone else will see if he's okay. I don't know about this.
I know where the AED is, but how do you use it?
Are you okay? Are you okay?
What would you do if you were standing in that line for coffee? Would you step up to help, or would you step back and let someone else do it? When a person's heart suddenly stops, providing CPR can double or even triple that person's chance of survival. Hello and welcome to the American Heart Association's Heart Saver CPR AED course. In this course, you will learn how to provide CPR, use an AED, and practice these skills all together. To help you along the way, your student workbook covers all the material and includes quick reference guides. If you complete all the course requirements and demonstrate the skills correctly, you'll receive a course completion card. Studies show that you need to review this information and to practice these skills frequently to maintain your ability to respond to a cardiac arrest. Now let's get back to the airport and see how these bystanders work together to save a life.
Anthony, are you okay? Are you okay? Help, I need help. You, what's your name?
Maria?
Maria, I need you to phone 911.
Okay.
I know where an AED is. Good, go get it. He's not breathing. 2, 3, 4, 5, 6.
Yes, there's a man down on the ground here at the airport. No, he's not breathing. Yeah, we're at Lakeway International Airport, Terminal C, Gate 37, near the coffee shop.
28, 29, 30.
I got the AED, but I don't know how to use it.
I got it.
Attach pads
Okay,
to
you'll
patient's
call
bare
airport
chest.
security? Yes, a man is doing CPR and someone got an AED. I don't know if I can answer all of your questions, so I'm gonna put you on speaker mode and put the phone next to the man who's helping him. This is the dispatcher.
Can you hear me? We have an AED. I'm attaching pads now.
Yes, I can hear you.
Plug in pads connector. Analyzing heart rhythm. Do not touch the patient.
Everybody stay clear. Don't touch him.
Shock advised. Charging. Stay clear of patient.
Everybody stay clear.
Deliver shock now. Shock delivered. Begin CPR.
1,
Start
2,
with compressions.
3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13.
I know CPR.
14,
If you're tired, I can take over.
17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Let's switch when the AED analyzes the rhythm again. All right. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Analyzing heart rhythm. Do not touch the patient.
Stand back, don't touch him. All right, get ready to take over CPR.
Shock advised. Charging. Stay clear of patient.
Everybody stay clear.
Deliver shock now. Shock delivered. Begin CPR. Start with compressions.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26.
Paramedics are here. Thank you.
30.
I can take over. Who can tell me what happened?
I work with the guy. His name's Anthony. We were just talking and he collapsed.
1, 2, 3, 4, 5.
When someone has a sudden cardiac arrest, for every minute that passes without CPR or defibrillation, that person's chance of survival falls 7 to 10%. By learning high-quality CPR and how to use an AED, you could help save a life. Now let's look at these terms more closely. CPR stands for cardiopulmonary resuscitation. It's made up of two skills, providing compressions and giving breaths. AED stands for automated external defibrillator. It's a machine with a computer in it that can detect an abnormal cardiac rhythm that requires treatment with a shock. An AED can deliver a shock to eliminate the abnormal rhythm. This allows the heart to resume a normal rhythm. But when and how do you know to provide CPR? Has the person had a heart attack or cardiac arrest? And what's the difference? Sudden cardiac arrest results from an abnormal heart rhythm. This abnormal rhythm causes the heart to quiver, so it can no longer pump blood to the brain, lungs, and other organs. Within seconds, the person becomes unresponsive and is not breathing or is only gasping. Death occurs within minutes if the person does not receive immediate life-saving treatment. A heart attack occurs when blood flow to part of the heart muscle is blocked. This blockage is caused when a clot forms in a blood vessel that carries blood to the heart. If the blocked vessel is not reopened quickly, the muscle normally nourished by the vessel begins to die. A person may have discomfort or pain in the chest or an uncomfortable feeling in one or both arms, the neck, the jaw, or the back between the shoulder blades. The person may also feel short of breath, nauseated, sweaty, or extremely tired. A heart attack can lead to cardiac arrest. When CPR is needed, compressing the chest can help blood get to the brain and other vital organs. We'll talk more about providing chest compressions and the proper way to do them in just a few minutes. First, it's important to know that when you provide CPR, you're taking part in the American Heart Association's adult chain of survival. This chain of survival shows the most important actions needed to treat cardiac arrest. The first priority is recognizing the emergency and phoning 911. After recognizing the emergency and phoning 911, the second link in the chain of survival is early CPR with an emphasis on compressions. This is followed by quick use of an AED, effective advanced care such as that provided by emergency responders and hospital providers who can give advanced support and post-cardiac arrest care. It's important to get help. Seconds are ticking away. In this course, you'll learn how and when to phone for help. Wherever you are, taking action starts with you. When faced with an emergency, you may be hesitant to act like some of the people we've just seen. But it's better to provide CPR to someone who doesn't need it than to not provide it to someone who does. And often, you're not alone. People around you generally want to help. An emergency can quickly become a coordinated rescue with everyone working together until someone with advanced training arrives and takes over.
Yes, there's a man down on the ground here at the airport.
Stay on the phone until the 911 dispatcher tells you to hang up. Answering the dispatcher's questions will not delay the arrival of help. The dispatcher will likely ask about where you are and what has happened. Dispatchers can provide instructions that will help you, such as telling you how to provide CPR, use an AED, or give first aid. That's why it's important to put the phone on speaker mode after phoning 911, so the dispatcher and the person providing CPR can speak to each other.
This is the dispatcher.
Can you hear me? I'm just unsure if I did the right thing.
Oh, you did. You did great. By providing CPR, you helped your friend until we could get here to take over.
20, 21, 22, 23.
After an emergency, you might have questions like Gene did. Did I do the right thing? Should I have done something differently? Did I do CPR the correct way? It's natural to hesitate or to question yourself and your abilities. This training will help empower you and help you overcome your hesitation to act. It's better to act than to do nothing. By taking action, you're increasing the person's chance of survival. When we go about our everyday lives and something like this happens right in front of us, it may take a few seconds for us to realize that this is actually an emergency. When we do, there are steps to follow in determining whether or not a person needs CPR. Before you start providing CPR, you need to make sure the scene is safe. Look for anything nearby that might hurt you. You can't help if you get hurt too. Next, you need to check to see if the person is responsive. Kneel at his side, tap him and shout, "Are you okay? Are you okay?" Someone who is responsive moves, speaks, blinks, or otherwise reacts when you tap him and ask if he's okay. Someone who does not move, speak, blink, or otherwise react, is unresponsive. If the person is unresponsive, shout for help. Here's a demonstration. While leaning over the person who is down, check to see if the person is responsive. Tap his shoulders and ask, "Are you okay? Are you okay?" If the person does not move, speak, blink, or otherwise react, then he is unresponsive. Shout for help. "Help! Help! I need help!" If someone is nearby and can help, have that person phone 911 and get an AED. Say, "You, phone 911 and get an AED." If no one comes, then phone 911 yourself. In an emergency, the sooner you realize that there's a problem and get help, the better it is for the ill or injured person. When Gene didn't get a response from Anthony, Gene asked Maria to phone 911, and Mark offered to get an AED. Gene then performed the next step in assessing the need for CPR. He checked for breathing. It all happens quickly, but this is important. When the person is unresponsive, scan the chest for 5 seconds, but no more than 10 seconds, checking for breathing. If the person is not breathing normally or is only gasping, he needs CPR. Then move the clothes out of the way to bare the chest. If a person is gasping, it usually looks like he is drawing air in very quickly. He may open his mouth and move his jaw, head, or neck. Agonal gasps are frequently present in the first minutes after sudden cardiac arrest. These gasps may appear forceful or weak, and some time may pass between gasps because they usually happen at a slow rate. The gasp may sound like a snort, snore, or groan. Gasping is not regular or normal breathing. It's a sign of cardiac arrest in someone who is unresponsive.
Someone who's agno breathing like that needs CPR right away. It's a telltale sign. I've seen it working on the job and doing CPR as a layperson.
It's important to recognize cardiac arrest as quickly as possible. CPR keeps a person's blood flowing until other medical care can be given. Let's look at these steps all together in assessing the need for CPR. Before you provide CPR, check to make sure the scene is safe and make sure the person is lying on his back on a firm, flat surface. Tap and shout to see if the person is responsive. If the person is unresponsive, shout for help. "Sir, are you okay? Are you okay? Help! Help! I need help!" If someone comes, have that person phone 911 and get an AED. You, phone 911 and get an AED. If no one comes to help and you have a cell phone, phone 911. Put it on speaker mode so you can hear the dispatcher's instructions and begin CPR. You will also need to get the AED yourself. Next, scan the chest for 5 to 10 seconds, checking for breathing. If the person is not breathing normally or is only gasping, he needs CPR. Move the clothes out of the way to bare the chest and begin chest compressions. The video will now pause while you get in position to practice scene safety and assessment.
Well, let me first talk about a few things. When I started teaching CPR 25 years ago, no one had a cell phone. If you did, they were probably the size of a briefcase, okay? So we were always teaching people, send someone to the telephone to call 911. But I want to let you know how cell phones work in the state of Massachusetts, and it's starting to change. To call 911 if I was to call 911 from my cell phone here, I wouldn't get the local Wellesley Police Fire Emergency Dispatch Center, okay? I'm going to get the state police. So what happens there is you have to be very clear when you're using a cell phone of where you are and what town you're in, okay? Because the state police are going to transfer you to the town you're in, okay? We have a little bit of a problem with another town about 90 miles to the south of us called Wellesley. Wellesley and Wellfleet sound a lot alike, and when the screen comes up at the State Police Dispatch Center, Wellesley and Wellfleet are next to each other, too, alphabetically, okay? So in the past, we've gotten some Wellfleet calls, they've gotten some of our calls, okay? Now, the technology is finally changing. There are some towns in Massachusetts, the nearest one to us is, believe it or not, Dover, where cell phones are being able to go right to the town you're in, okay? What happens is when you pay your cell phone bill, there's a little, all those fees you have. some of those fees go to running a 911 system. So, but what's good about cell phones now is the speaker mode. Instead of having to go somewhere to call 911 or send someone can call or by yourself and you can put it on speaker mode. Now, all Massachusetts police dispatchers are trained in how to give CPR instructions. They used to have a booklet, like they'd flip through. I was just talking to them earlier this year. It's now all on their computer at dispatch. They just type in CPR instructions and everything comes up. And that goes for certain first aid and for choking too. So, all right. Any questions so far? All right. Another quick thing with CPR, you cannot be sued for CPR for doing CPR and it fails. It's the Good Samaritan Act. That it's a federal law that says if you do CPR or first aid to the best of your training, you cannot be sued for if the person passes or so on. So you don't have to worry about any lawsuits. Yes, Marie.
So for someone who might not be trained in CPR, would the Good Samaritan law still protect them? If they were to do it because, there's no other option?
Yeah, it should protect you. I've never heard of anybody challenging the Good Samaritan. Good Samaritan Act is the real term. Yeah, the only way you'd get in trouble is you saw on Grey's Anatomy. That we're gonna open the heart up. Yeah. So, but I get that question a lot. Is can I be sued? And you can't. That law was enacted way back in the '60s. Brandon.
Maybe it'd be better to put that microphone near us.
Yeah, that's actually a good idea.
I thought that, I don't know, hopefully this is good. When you're checking for breathing and signs of life, you're supposed to put your ear down by their mouth and watch and look for the chest to rise.
That's the old look, listen, and feel. I'm glad you brought that up. We used to teach, remember ABCs for CPR, airway, breathing, circulation? Now it's called CAB, circulation, airway, breathing.
Right.
And for the layperson, people were getting so confused about checking for breathing and all. They came up with an easier way. Just look at the chest.
Right. So you're not checking for a pulse or anything?
No, you're not being taught to check for a pulse or anything. Those days are gone. That used to be a big problem with lay people because even with us EMTs on the ambulance, nurses, it's hard to find a pulse. Never mind when you think in cardiac arrest and you're trying to find a pulse.
Right.
So back in the old days, they were like, no, you can't do CPR on someone who you're not sure of. Right. Now, no breathing, unresponsive, no breathing, you start CPR. Okay? Yeah, and that's what's helped the rates go up too. So we're gonna bring over my mannequin. And so CPR needs to be done on a hard, firm surface, the floor, okay? We don't do CPR like in bed on a mattress or on a couch. We need the person on the ground. And I always get the question is, how do I get them on the ground if, well, if they're in cardiac arrest, you get them any way you can because they're not going to feel it, and you literally just pull them, get them anything down on the ground, okay? So what we're going to do now is we're going to do a practice of, let me get my cheat sheet here. We're going to go up to the patient and check for unresponsiveness, okay? So we're going to say, are you okay? You okay? Kind of shake the shoulder, okay? If they're talking equals breathing. Breathing means we got a heartbeat. They could maybe say, I fell, I don't know, I don't feel good, and so on. They may still need help, okay? But they're talking. Talking's a good thing. It's when we get into infant CPR, we love on the ambulance a crying baby because a crying baby's a breathing baby, okay? So, and also, you're going to hear all during today's, we're supposed to make sure the scene is safe because we don't want to go into a unsafe situation. Okay. I get no response. I tell someone to go phone. I ask for help and tell someone to phone 911. And I don't just say someone called 911. If I know the person, I'd say Marie, Heidi, or Brandon, you call 911, okay? If I don't know you, I'd go you. You call 911, because we don't want to be like, well, they'll call 911 or they'll call 911. So we always want 911 coming, you know, even if we don't end up needing it, we always want it coming, okay? So I am now, so we got 911 coming, and I'm going to check for what they said for, just look for the chest rising, okay? Someone with a normal breathing pattern, you'll see the chest go up and down, okay? That agonal breathing that you saw in the video is not normal breathing, and it's very distinct. So, okay, I see no breathing. I know I need to start CPR. I'm also going to ask someone to find a AED or automatic external defibrillator. We call them defibs. You probably use that term too, the defib, okay? And I'm going to start in on compressions, okay? I'm going to switch mics here. Okay, you need to clear the clothes off the chest so you can see where you're going to do your CPR, okay? The proper landmark for CPR, we have the breastbone or the sternum, and we have the nipple line. We want to do CPR, what we call over the lower half of the sternum, which is, if you draw a line between the nipples, center of the sternum, just below that, okay? And I'm a righty, so that's my dominant hand. That's the hand I like to do the CPR on, okay? So find my landmark. I got the chest bared, and see, this is why you need to do it on the ground. I want my legs close up to the patient. I got my CPR hands, and see how my elbows are straight and locked, okay? That's good, because that means all my compressions are going to go down to compress the heart, okay? And I just want to use the heel of my hand. See how my right hand, my fingers are not touching the patient. If I was like this, I'm going to kind of lean over and not do good CPR. So they're extended, I'm straight up, and I'm going to do 30 compressions to 2 breaths. Okay? So I'm going to go 1, 2, 3, and 4, and 5, and 6, and 7, and 8, and 9, and 10, 11, and 12, and 13, and 14, and 15, and 16, and 17, and 19, and 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, I did 30 compressions. I'm now going to do 2 breaths, okay?
It's important to consider the position of the ill or injured person before providing CPR. If the person is breathing normally and is unresponsive, this person does not need CPR. You can place the person on his or her side until someone with more advanced training arrives. To provide high-quality CPR, you do 4 things. Provide compressions that are deep enough, provide compressions that are fast enough, allow the chest to return to its normal position after each compression, and don't interrupt compressions for more than 10 seconds. Compressions are the most important part of CPR. However, high-quality CPR has 2 main skills, providing compressions and giving breaths. We're going to demonstrate both and give you a chance to practice. When providing compressions, it's important to push hard and fast on the chest. So let's just focus on compressions right now and take a look at how they should be done. A chest compression is the act of pushing on the chest. When you push on the chest, you pump blood to the brain and heart. People are often afraid of causing injury to a person from providing compressions, but injury is unlikely. You need to push hard and fast at a depth of at least 2 inches and a rate of 100 to 120 compressions per minute. Let's watch this demonstration, then you'll get to practice. You can follow along with what's on the screen as you provide the compressions yourself, and then we'll switch students when the video instructs you to. Each student will perform 2 sets of 30 compressions. And remember, we'll be providing compressions at the rate of 100 to 120 compressions per minute, while counting them out loud. Make sure the compressions are at a depth of at least 2 inches and allow the chest to come back to its normal position between each compression. Our aim is to minimize interruptions in chest compressions. These interruptions include those needed to deliver breaths and as you take turns doing compressions.
Right now I'm just going to have you practice. You're not going to do anything else but chest compressions, okay? So we're going to do 2 sets of 30. So why don't, Marie, you come up. And since I'll help you here. What we're going to do in this process is we're teaching you compressions, mouth to mouth, and then at the end we're going to put them all together, okay, for you to learn CPR. So are your knees okay? Yeah. Okay. So to do proper CPR, we need the skin bared. Here's our sternum, breastbone. Here's what I do the nipple line. So I'm right just below that nipple line, okay? So let's see what your hand placements will be.
Okay, so nipple.
Yeah.
Okay.
Yep, right.
So I'd go.
Yeah, right about there. That's
Okay.
good. Now, have your legs touch the patient.
Oh.
And now I want these extended.
Okay.
Okay? Now, try this, like that. Now go down, okay. A little faster and count out loud.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Okay. Pretty tiring just doing 30 compressions, huh?
Yeah.
Yeah. So,
Okay.
okay, Marie, I'm going to have you do, you can go sit down, Marie. I'm not going to do the 2 sets.
Can I ask you, how do you know if you've done them deep enough?
The hardest part I have teaching CPR is because the body's totally relaxed in cardiac arrest. When you're over the patient like this with your arm straight, you're putting all your force down. It's going to be deep enough because there's no resistance.
Right.
This CPR mannequin, it's actually easier on a real human.
Oh, okay.
This is a little more it's the best it can be, but
Yeah.
yeah.
So it gives you the feedback, though, that you're...
Oh, yeah, you'll know
You
you're
know.
going down, yeah.
Okay.
It isn't like you're doing something on this.
Right,
No,
right,
no.
right. Okay.
Yep. Yes. And you can break the ribs and sternum, especially on an elderly person. But you won't know you're doing it, but, that's okay because they're in cardiac arrest.
Yeah.
Okay. Yep. Get your hands and go down. 2, 3, 4. I'm just going to move you a tad right there.
6, 8, 9, 10, 11, 12, 13, 14, 15, 16, 18, 19, 20, 21, 22, 23, 24, 25, 27, 28, 29, 30. Oh, do you hear my knees?
Yeah, I'm the same way.
Oh,
I'm the
my
same
goodness.
way.
But my adrenaline
Yeah.
will be going. So
Your adrenaline's going.
it doesn't matter if my knees
You won't, right.
So we're not putting it together, we're just doing the compressions right now?
Yeah, I'm just
Okay.
teaching compressions.
Okay, so I'm gonna come here right below the line. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 25, 26, 27, 28, 29, 30.
Okay, good, Brent.
Perfect.
So you heard in the video, and what we're teaching now is high quality CPR. So what we want a rhythm that So when I'm pressing down the heart, that's when I'm forcing blood out to the brain and other major organs. When I come up, that's the heart refilling. That's a very important part of CPR. So we get blood, so then we press down again, it's going out. So that's why they say 100 to 100 beats a minute, okay? Now, aging myself here, and Heidi's been in my classes, she probably know what I'm going to say. The Bee Gees' Staying Alive is what you call it, I guess, 100 beat per minute song. It's perfect for CPR, because it's got the beat. So another reason why when I teach the younger children, they kind of look at me like, who, what? And I'm sure there's other songs out there. But what I do as a teaching tool is when I'm counting out loud, when I say the number like 1, I'm going down. Then I say and, I'm coming up. That means the heart's refilling. 2 and 3 and 4 and 5 and 6 and 7 and 8. That gets you kind of in the rhythm, okay? And I never want to take my, while I'm doing the third, eat my heel off the chest. So, okay? All right.
Now we're going to learn the second skill of providing high-quality CPR, giving breaths. Before giving breaths, open the airway. Opening the airway correctly will help keep the tongue out of the way to make sure your breaths are effective. As you practice this skill today, you'll be doing so on a mannequin. Remember, you don't want to interrupt compressions for more than 10 seconds to give breaths. To open the airway, follow these steps. Begin with your hands on the mannequin's chest, because you will always be giving breaths after compressions. Put one hand on the mannequin's forehead and the fingers of your other hand on the bony part of the chin. Then, tilt the head back and lift the chin. This simple action lifts the tongue from the back of the throat, opening the airway. It's important to avoid pressing into the soft part of the neck or under the chin because this might block the airway. While holding the airway open, pinch the nose closed with your thumb and forefinger. Take a normal breath. Cover the mannequin's mouth with your mouth. Give 2 breaths. Blow for 1 second for each. As you give each breath, you should look down at the mannequin's chest to see it rise. Actually seeing the chest begin to rise is the best way to know that your breaths are effective. Remember, if you give someone a breath and the chest doesn't rise, allow the head to go back to its normal position. Then open the airway again by tilting the head and lifting the chin. Then give another breath. Make sure the chest rises. Don't interrupt compressions for more than 10 seconds to give 2 breaths. The video will now pause while you get in position to practice giving breaths. You'll try 3 sets of 2 breaths, and you'll start and end each time with your hands on the mannequin's chest. Get ready. 3, 2, 1. Starting with your hands on the mannequin's chest, move to open the airway. Put one hand on the forehead and the fingers of your other hand on the bony part of the chin. Tilt the head back and lift the chin. Hold the airway open. Pinch the nose closed and take a normal breath. Cover the person's mouth with your mouth. Give a breath for 1 second. Give a second breath, blowing for 1 second. Again, watch for the chest to rise. Go back to the compressions position. Okay, try again. Tilt the head back and lift the chin, and pinch the nose. Give a breath. Give a breath. Okay, try again. Tilt the head back and lift the chin, and pinch the nose. Give a breath. Give a breath. Go back to the compressions position.
What I'm going to teach you is doing mouth-to-mouth with a barrier device. We're not really going to use it. We're going to place it and so on. Because mouth-to-mouth is, doing it on a stranger. I don't know, So if you had a barrier. But when we switched over to the instead of airway breathing circulation, we switched over to circulation airway breathing. Compressions are so much more important now than breathing. We're even finding when I work on the ambulance, when I first became an EMT, we gave oxygen to everyone. You stubbed your toe and we're on the ambulance, give them oxygen, it can't hurt them. Well, that's all been come back now because you can get too much oxygen. We're only giving oxygen when people really need it. So, worst case scenario, someone in cardiac arrest, a stranger out, you have no barrier device, anything. I'm a big proponent of compression-only CPR. This course I'm teaching you because it's heart saver, mouth-to-mouth and everything. But compression-only CPR, compressions will and get help coming, okay? Because I do know firsthand, I did CPR on a beach in Eastham 3 years ago, and on just did compressions only of a young person who went into cardiac arrest, and thank God it was a great outcome because she's alive today with living and everything. But all I did was compression CPR. So, but in this thing, Heart Saver, we are teaching mouth to mouth. You may, family member, you do mouth to mouth. Oxygen and respirations are more important with children and infants. And when we do that, I'll tell you why. Do we have any questions?
So if we do CPR only, how much do we wait between sets?
I like to wait five seconds, see if I see any breathing, anything. Yeah, okay. and just go into it. Yeah.
But if they're near water,
yeah,
is that totally off topic? Like then you start with breaths. That's a different thing.
Yeah. See, I know. You're looking at the lifeguard end of it.
Yeah.
Is that? See, we're teaching any CPR.
Yeah. Sorry.
Even that water rescue, we're teaching compressions, airway breathing. Okay. I know lifeguards might be trained, while there's they're getting out of the water, trying to get air into them and so on. Yeah. So. Okay. I see we got jazz dance going on next.
Yeah, Zumba.
Zumba, that's what I was trying to think.
Yeah.
Okay, I want to find I'm going to get the barrier, how to do the barrier mouth to mouth.
You may give breaths with or without a mask. If you're in the workplace, your employer may provide personal protective equipment, including pocket masks for use during CPR. There are many different kinds of masks and face shields, and there are different sizes for adults, children, and infants. So make sure you're using the right size. Your instructor may also discuss other types of devices that can be used when providing breaths. Masks or shields are made of plastic and fit over the person's mouth or mouth and nose. You may need to put a mask together before you use it, but this is usually as simple as popping it into shape and attaching the one-way valve that goes with the mask. That's the part you breathe into. So let's take a look at how to give breaths with a mask. We're going to show you a demonstration on how to place the mask and give breaths. Afterward, we'll give you a chance to practice giving breaths with a mask. Start out kneeling next to the mannequin with your hands on the chest. Put the mask over the mannequin's mouth and nose. If the mask has a narrow or pointed end, put the narrow part of the mask on the bridge of the nose, and the wide part of the mask should cover the mannequin's mouth. Tilt the head and lift the chin while pressing the mask against the mannequin's face. It's important to make a good seal between the mannequin's face and the mask while you lift the chin to keep the airway open. Now that you've got the mask positioned, give 2 breaths while watching for the chest to rise. As you give each breath, you should look down at the mannequin's chest to see it rise. Actually seeing the chest begin to rise is the best way to know that your breaths are effective. After giving the breaths, go back to the position to give compressions. Remember, if you give a breath and the chest doesn't rise, you need to reopen the airway and reposition the mask to get a better seal. Give another breath and make sure the chest rises this time. Interrupting compressions for no more than 10 seconds total. If the chest doesn't rise, begin pushing hard and fast on the chest again. Now we're going to practice using a mask to give breaths.
Okay, So I see Brandon brought one.
Yeah, I've had it in my backpack for a long
Yeah.
time.
So I'm going to switch over.
Yeah.
So there are other types of barrier devices. This is the mask you just saw in the video, which I'm going to show you. Remember he said you got to put it together? Okay. And the point always goes towards the nose. Okay. Oh, do you got more than one? Oh, you got, great for when we do children. Great. That's good, Brian. Okay. And what this is a one-way valve. You blow in, it opens to let air in, but it shuts. So you're not getting any contact with body fluids with the patient. Okay. There are other ones too, like I carry something like this version on my keychain. These are disposable face shields. And what's neat about these is they come with a picture. So you know where to, and this is just a barrier, you know, and it even has directions, but I'm a man, we don't read directions. So that's that. Marie, I'm going to have you come down, and I'm first going to show you, before we do the barrier mask, how to open an airway. I should have done that earlier. So you're comfortable on that side of the, okay. Okay, to open an airway on a person, okay, we want to have one hand, I'm sorry, I'm not, one hand on the forehead, and I like a couple fingers on the bony part of the chin. I don't want to be down near the Adam's apple or anything in here. And what you're going to do is just push back. Okay. And a person who's unconscious, the muscles are totally relaxed, is going to go back. What that is doing is getting the tongue out of the way so we can get air down the trachea, okay? And just if you were to do mouth-to-mouth, let's say you had a family member, okay? You need to open the airway, and then this hand pinches the nose, and you would completely seal the mouth and blow into it and see the chest rise, okay? So, just show me that, Marie, how you do open an airway. Now tilt back, push it back, do it. Yeah, it's all right. This mannequin's been used a lot. Hopefully I get that grant and get new mannequins, okay?
Is there such a thing as tilting it too far back?
No, this goes too far back because it's been used so much.
Okay.
It'll just be a natural.
Okay.
You can't, no.
Okay.
So, all right. So let's say, so now here's the mask, okay? You saw, it came collapsed in the case, and I just pushed out and
Put that in.
See, it'll only fit on one end, so you know you won't get mixed up. So yeah, put it on the end. Okay. Now make sure the triangle goes to the nose, and you need to keep the airway open. So I find this is what we teach, like. When I'm teaching EMTs, when we're using a bag mouth, we call it the CE, to hold the mask and open the airway. See how I'm making a C there? I got it down there, and the E is just, these fingers kind of look like an E.
Oh, okay.
And then see how I'm like that?
Yeah, yeah.
You don't have to go all the way back, okay? And then.
So CE,
and then you would blow into that, pretend to blow into it. The chest would rise, then blow into it again, okay? And then we'd go, okay, and that's how we do your airway. All right, Heidi, you want to come on down? So Heidi, just show me how to open an airway with that, just to get the tongue out of the way, you saw? Yep, okay. Now pretend you're doing compressions, and let's say you're on 29, And 30. Now you're going to do compression. So I'm going to pretend you'd put that together. And this goes
On there. Nope. Goes
the other
this
end.
way.
Yep.
Okay.
Do your CE. Yep. Keep your hand perfect. What we're doing, like Marie and Brandon, is, getting that tongue out of the way. We're getting air into the trachea. Okay. Whatever side you're comfortable on, Brandon.
Yeah.
I think it's, yeah.
Okay, so.
Well, so pretend we're on 29,
29, 30.
Now show me how to open the airway.
So we're gonna push the head back, open the
Yeah.
airway,
Okay.
assemble this,
Yep.
put it together,
Do your
Hold that
CE,
in.
yep.
and
And
then,
chest would rise, and then we go right back
and
into
then right back
CPR.
into compressions.
So, good.
Perfect.
Just to quickly show you how this thing would work. I just line up the face. And this I would have to pinch the nose. The reason we pinch the nose when we do mouth to mouth, if we didn't, all the air I blow in would come out the nose. But this is just like that. Any questions?
So if we have like 2 attempts to open the airway, and for whatever reason, the head isn't positioned right, and we're trying to give breaths, do we just go back? We only have 10 seconds, right? Really?
Right. Go right back.
If
Go-
we're getting frustrated with.
Go to compressions.
Go to compressions.
Do another 30 compressions, then try it again.
But don't get hung up on trying to get,
Right.
the
The compressions
head.
are so much more important, okay? That's why we went, when they changed it years ago, those of you remember the days we used to have to teach finding a pulse, doing the breathing. It was costing seconds, and it was getting people, I don't want to do CPR, okay? 2 attempts, you don't think you're getting a breath in, go into CPR. Because when we get into choking, the person may be unconscious and choking.
That's what I was thinking
Yeah.
about. Yeah.
Yeah, so, all right. You know what? I like this mic better. Now I'm dating myself. Remember Match Game, that TV show? Remember he had a long mic like this?
By now, you've learned how to provide compressions and give breaths with and without a mask. Let's look more closely at using an AED. Even though you may be in the midst of providing CPR, once the AED arrives, use it immediately. Let's go back to our scene with Gene and Anthony. We'll pick up just before the AED arrives.
28, 29, 30.
I got the AED, but I don't know how to use it.
I got it.
I don't know if I can answer all of your questions, so I'm going to put you on speaker mode and put the phone next to the man who's helping him. This is the dispatcher.
Can you hear me? We have an AED. I'm attaching pads now.
Yes, I can hear you.
Plug in pads connector. Analyzing heart rhythm. Do not touch the patient.
Everybody stay clear. Don't touch him.
Shock advised. Charging. Stay clear of patient.
Everybody stay clear.
Deliver shock now. Shock delivered. Begin CPR. Start with compressions.
CPR combined with using an AED provides the best chance of saving a life. If possible, use an AED every time you provide CPR. When sudden cardiac arrest develops, the heart quivers and stops pumping blood. A shock from an AED stuns the heart so that the heart's rhythm can reset and the heart can pump blood again. To use an AED, you simply turn it on by either pushing the on button or lifting the lid. Once you turn on the AED, you will hear prompts telling you everything you need to do. AEDs may have adult and child pads. Make sure you use the adult pads on anyone 8 years of age or older. Peel away the backing from the pads, following the pictures found on the pads. Attach the adhesive pads to the person's bare chest. If the AED recommends a shock, it will tell you to stay clear of the person. If the AED tells you to clear the person, then loudly state, "Clear." Look to be sure no one is touching the person just before you push the shock button. As soon as the AED gives the shock, immediately resume chest compressions. Following this demonstration, you will have a chance to practice using an AED trainer, just so you can see what it's like. You'll start with your hands in place to give compressions, and the AED will arrive immediately. First, Turn on the AED by pushing the on button or opening the lid.
Attach pads to patient's bare chest.
Follow the AED prompts and the pictures on the package or pads.
Plug in pads connector. Analyzing heart rhythm. Do not touch the patient.
Okay, everyone stay clear.
Shock advised. Charging. Stay clear of patient.
Okay, everyone clear.
Deliver shock now. Shock delivered. Begin CPR. Start with compressions.
You'll need to consider a few special situations when using an AED. First, if the victim has hair on his chest, the hair may prevent the pads from sticking. If your AED has only one set of pads, a razor should be included. You can use the razor to quickly shave the area and then apply the pads. If your AED has two sets of adult pads, you can apply one set to the hairy chest. If the hair prevents the pads from coming in contact with the chest, the AED should tell you to check the pads. If it does, press the pads down more firmly. If they still aren't sticking, rip the pads off forcefully, removing the chest hair. Then reapply a new set of pads to the bare skin. Water on a victim's chest can also be a problem. It could allow the shock to travel through the water between the pads, ultimately preventing delivery of an effective shock dose to the victim's heart. If someone is lying in water, you should quickly move the victim to a dry area. However, if the victim is lying on snow or in a small puddle, you may use the AED. And if the chest is covered with water or sweat, wipe the chest before attaching the AED pads, but wipe the chest quickly. It doesn't have to be completely dry. Some people have an implanted pacemaker or defibrillator in the same place where you would put the AED pads. These devices look like a round or square lump smaller than a deck of cards. If you see this lump, avoid putting the pads directly over it. Also, do not place the pad directly over a medicine patch. If a medicine patch is located where you need to place a pad, take the patch off and quickly wipe the chest before you put on the pad. If your workplace has an AED, you should familiarize yourself with that AED. Regardless of the type of AED, remember to turn it on first and follow the audible prompts that will lead you through the rest of the steps. Additional emergency equipment may also be found in the AED, such as scissors, razors, wipes, gloves, and a barrier device. These items may also be found in a separate emergency or first aid kit. AEDs can be used for children and for infants too. Many AEDs have pads for adults and a child pad cable system or a key. But if there are no child pads, or if there isn't a child key or switch, use the adult pads. Also, if the child is 8 years of age or older, use adult pads.
Okay, I have a trainer here. This is just a trainer, but it actually lets you hit the shock button, okay? Real ones, we cannot practice on because they will not shock. Okay, as I said earlier, oh, I don't have my microphone. As I said earlier, this has been a game changer, defibrillators, okay? And everyone, they do it wrong on TV, okay? On TV in those medical shows, you see, oh, they flatlined, so you got a defib. It's just the opposite. You can't defib. A flatline means the heart's this. It's not doing anything. What we want to defib is two heart arrhythmias, VTAC and VFib, like you saw in the video. It's doing this. And what the defib is doing is stopping that, and then Mother Nature hopefully is saying start beating on its own, okay? So, a lot of the defibs, if you send someone to go get a defib, or you're the person going to get the defib, turn it on when you first get it. It just eliminates one step, okay? All right. In Wellesley, the defibs, the pads are already, what we call the electro pads, are already connected within the unit, okay? Just hold on a second here.
Analyzing heart rhythm.
Okay, let's see something here.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
Okay, it's got a flashing.
Apply pads. Analyzing heart.
This trainer goes a little bit too fast. I have another trainer one, but I think it goes too slow. It tells, apply left pad, press firmly. It would be here all morning. But what I want to talk about is the pads. And this is why all of them, all pads have where you place them. Okay? And this needs to be done on a bare skin. It can't be done over anything. And like you saw, someone is wet, you know, it can be done on a pool deck, you know, just wouldn't want to be, you can't do it in water. It's like wiping off. I have defibbed in a snowstorm before with no problem. So you just apply your pads like it shows. I'm going to plug that in, just not turn it on yet.
Does it matter which goes where?
It tells you, yeah. What we're doing is sending a shock through the heart, these. So I had a class once with an electrical engineer. So he gives me a trick question, you know, what kind of shock? And I know it's 360 joules, but I'm not an electrical engineer. He said, wow, that's a lot of electricity, you know, and he explained how it's working, okay? So, see, I have the pads on, okay? I'm gonna follow, and all the defibrillators have some, the voice, just like on your GPS in your car there, you know, telling you what to do, okay?
Analyzing heart rhythm.
Okay, I'm gonna stop. What we're doing now is, okay, if you had two people, you'd be doing CPR up until the time the pads apply, and you're analyzing the heart rhythm, okay? When they're analyzing, the patient needs to be completely still. Any movement in the computer won't pick up any shockable rhythm, okay? So you're gonna say, everyone stay clear.
Analyzing heart rhythm.
So the computer is now analyzing whether.
Do not touch the patient.
Don't touch the patient.
Shock advised. Charging.
The unit will make a kind of a charging noise. And this is where everyone clear.
Deliver shock now.
A button.
The orange button now.
The ones in town have like a lightning bolt button.
Shock delivered. Begin CPR.
And then all the defibs, you do 2 minutes of CPR. This is count, and not 30 and 2, just 30 compressions. Because what's going to happen after 2 minutes, it's going to reanalyze and start over.
So once you attach the AED, you do not do breaths?
No, because, yep.
Have you ever been in a situation where you've had to shock more than once?
Yes, yeah.
Is that right? Is that common?
Yes, yeah, yeah.
And after it shocks, it does a quick analysis, right? So that, I mean, if the heart suddenly goes back into sinus rhythm, then you're not going to be doing compression. So it will tell you.
No, that's one thing it doesn't do. It'll make you do the 2 minutes of CPR.
Even if it's in...
Yeah, because it can't tell you it's in a... But then when you go to analyzing, it'll say no shock advised.
Okay.
And that's when you either look for signs of life, you know, breathe in movement, or go back into chest compressions again.
After the 2 minutes.
Right.
Okay.
Have you ever brought someone like back? Has that like ever revived somebody on the spot?
No, not like they're talking to you and all.
But yeah,
Yeah, that's, yeah. We've gotten them back, you know,
Yeah.
into the ambulance and into the hospital. I just lost my train of thought on something I was gonna tell you. All right. Oh, you know, and I should have said at the beginning, when we're talking adults in CPR world, we're talking, you know, about age 8 and above for adult, about age 1 to age 8 for a child, and infant is birth to age 1. Whenever in doubt, go to the higher level. So, and that's also with the defibrillator. When we do child and infant defib, I'll show you. So right now, I'm gonna have Marie come down and set up the defib machine. What I'm gonna do I don't think you'll have a microphone in your way when you might, you never, okay. So what I'm gonna have you do, Marie, is hit the number 1 button to turn on the machine.
Apply pads to patient's bare chest, analyzing heart rhythm.
See, this goes too quick. So what we're gonna do is put these pads on like you see in the picture. Okay? You take the sticky stuff off. Just rip it off. It just goes just like that. Now hit the button.
Analyzing heart rhythm.
So we're don't touch the patient. The computer's looking to analyze.
Shock advised.
Charging. And this is when you go,
Stay clear.
you tell everyone stay clear, because if you're touching that and it shocks, you're gonna get shocked. Hit the button and shock.
Shock delivered.
Okay? And now start going.
CPR.
Just go into regular CPR like I taught you. With the pads on, yep.
2, 3, 4, and 5, and 6, and 7, and 8, and 9.
Okay,
and 10.
that's good.
Okay.
It's gonna count down 2 minutes. I'm not gonna do it because it takes too long. And
Oh,
then,
so that counts for you?
yeah.
Oh, okay.
That counts
okay.
for you.
Great.
And like the ones we have in Wellesley have some of them have a countdown clock too. And it
Okay.
starts at 2 minutes.
Okay.
So, all right, Heidi. Yeah. Don't plug it in right away, put the pads on.
I'm just going to listen to what it tells me to do.
Okay.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
Just a tad bit lower.
Apply pads. Plug in connector.
Okay, now plug in the connector.
Analyzing heart rhythm.
Yep, everyone stay clear.
Do not touch the patient. Shock advised.
Everyone stay clear.
Charging. Stay clear of patient. Deliver shock now. Press the orange button. Shock delivered.
Now go right into CPR.
Begin CPR.
So should be doing 2 minutes of CPR, and it won't let you do anything till those 2 minutes are up. By doing CPR, we're keeping oxygenated blood going to the brain, and we're helping the heart. Maybe it wasn't in a good shockable rhythm to get it into that shockable rhythm. Okay? Sure.
So, let's say you were doing this by yourself and there wasn't a second person helping you. So it takes time to get the fib going and all of that. So how do you make that judgment call between letting more than 10 seconds go by?
Once you get the defib, because overall we want the defib used.
Okay.
Okay, you stop your CPR, you're by yourself, get the pads on, do everything it says.
Okay.
Defib is number one priority.
Even if you're exceeding those 10 seconds?
Yes, because you're getting a defibrillator on. All right, I'm gonna have you turn the. Oh, that's a good idea.
Thank you.
Okay, so
Turn on
normally
the button, green
yeah.
button.
And then we're gonna normally we'd plug it in first, but so it doesn't go too fast.
Yeah.
Okay.
Plug-in pads connector next to flashing
Use a little bit lower here.
This one a little bit lower.
Okay.
Analyzing heart rhythm.
Okay.
Do not touch the patient.
All right, now stay clear. Stay
No one move.
No one move.
Shock advised.
Okay, so stay clear. Stay back.
Charging.
Charging noise.
Stay clear of patient. Deliver shock now.
Okay, delivering the shock.
Shock, yep.
Shock is there.
Shocking.
Shocking.
Delivered. Begin
Go
CPR.
right.
And it'll tell you, it tells you everything.
Right.
Defibs we call a firefighter proof. If we can use them, anyone can use them. That's good, Brandon.
Perfect. There you go.
And they all do that, right?
Yeah.
In any town?
Yes, this is a trainer, there's different makes, but they all work the same way. They may look a little differently. But in Wellesley, we all have the same ones in every town building, so they all
The
look.
black and yellow ones. We have one right outside our office.
Yeah.
Do they have one upstairs?
The health department has one.
Too.
Yeah. They're in every town building, every fire truck, every police car. The schools, the elementary schools have one outside the nurse's office. Middle school, high school have one on every floor.
Right.
Plus, the high school athletic trainer has two of them because they have to have them with them now. It's state law.
I have one here from the Morris's Palm here. If I'm gonna go grab it. I have like the real one.
Yeah, you know what? Why don't we, that's a good idea. Why don't you, so you can see what the real one looks like. We're going to take 5 minutes there, James.
Okay.
I
Yeah.
think the one thing a lot of people forget is to turn it on.
That's right. Yeah, all the AEDs, defibs look like in Wellesley. Okay, this is a real one. Okay, they have a 6-year battery, and you'll see, that means the battery's okay. It says okay.
We bought it last summer.
Yeah, right. And these you just unbutton. Okay. See, the pads are here. Some of them are already connected. This only connects one way.
I think we only have adult pads.
Right, for this, yeah.
Because for the kids, you just go front and back.
Yeah, I'll get, but this is what a real, and see these, the pads,
Well, that's for a baby. That's a PD.
no, it's got adult.
Oh, I'm sorry.
Yeah.
You're right. It says don't put it on the baby.
But you would rip these right open, okay? And then they'd have directions on them. And see how there's only 2 buttons? They won't let me go any further, but
I've never ever turned that on.
Connect electrodes.
it's telling it to put the pads in. That's a fancy word to connect the pads. It won't let me go any further. But if I connected them, the lady would go
Connect
analyzing.
electrodes.
Okay? And if it said chalk advised, this lightning bolt red button would light up.
Yeah.
Okay?
And if you were to push
Check
that button
connector
right now,
and
it would do a
electrode.
thing.
No,
Yeah, because, yeah.
it can't. You cannot shock someone who doesn't need it. The computer does all the work.
That's
It's fail-proof.
Check connector
All right.
and electrode.
That's great.
So there's no such thing as second guessing whether you should use it?
No. Use it. It's what the people, they need. Yeah. And you will see, I'll tell you, when you shock someone, the body is going to move. It's going to jerk a pretty good amount. You'd be surprised. It's going to do. Okay? That's why you never want to be touching the person because you'd get that shock. Okay. Now, I forget, did we do everyone with the defib? You all did it, right? Awesome. Awesome. see where I'm at here. Any questions on the defib? When we do child and infant, I'll show you how to do an infant and child.
You ever had to use an AED on an infant before?
We
That sounds like it'd be horrific.
No, I've only done CPR on an infant once in my 26 years.
That sounds awful.
And it was awful. It was a SIDS case.
Yeah.
So thank God I haven't had to do. I've done an infant CPR once.
So if you don't have the smaller pads, you would still use an adult pad?
I'm going to show you. Yep. Because it's better than nothing.
Yeah.
Let me see where I'm at here in the video.
Now we're going to demonstrate how to put it all together, from scene safety and assessment to providing compressions and giving breaths to using an AED. Afterwards, you'll get a chance to practice. First, check to make sure the scene is safe and make sure the person is lying on his back on a firm, flat surface. Tap and shout to see if the person is responsive. If the person is unresponsive, shout for help. Sir, are you okay? Are you okay? Help, help, I need help. And ask someone to phone 911 and get an AED. You, phone 911 and get an AED. Next, scan the chest for 5 to 10 seconds, checking for breathing. If the person is not breathing normally or is only gasping, he needs CPR. Move the clothes out of the way to bare the chest and begin chest compressions. Now, tilt the head back and lift the chin to open the airway and give 2 breaths with the mask. Remember, do not interrupt compressions for more than 10 seconds. Repeat. Now, tilt the head back and lift the chin and give 2 breaths with the mask. Once the AED arrives, use it immediately. First, turn on the AED by pushing the on button or opening the lid.
Attach pads to patient's bare chest.
Follow the AED prompts and the pictures on the package or pads.
Plug in pads connector. Analyzing heart rhythm. Do not touch the patient.
Okay, everyone stay clear.
Shock advised. Charging. Stay clear of patient.
Okay, everyone clear.
Deliver shock now. Shock delivered. Begin CPR. Start with compressions.
What we're going to do now is we're going to do the whole thing. So what's going to happen is you're going to come to the patient. Let me get the lights here. Okay. I'm going to have your adult skill sheet.
Yes.
One that says adult. So first thing I want you to say is the scene is safe. Okay. You know what? Hold these for now. I'm going to read off one. We'll go over what I'm going to do the skill sheet on. That'll be easier for you. Okay, see, I'm going to a scenario that you arrive on the scene of a suspected cardiac arrest, no bystander CPR, that means no one's doing CPR. You approach the scene, ensure the scene is safe, and demonstrate what you do next. You're going to check for unresponsiveness. You okay? You okay? Help, help. Someone call 911 and get an AED. We're going to then check for breathing by looking at the chest. We're going to go down and do 30 compressions. And we're going to do 2 breaths with the mask, you know, like the mask, open up the airway, okay? We're going to do a second cycle, and then we're going to say the defibrillator arrives, and you'll put on the defibrillator, okay? Easy peasy, right? We can do this. I'll be here to help out. So, who wants to go first? We'll start with Brandon. Let me see that sheet then, 'cause I gotta mark off.
I'll be the one to go get the AED. How about that?
Yeah, that'll be good. We'll stay here, yeah. We'll have Heidi be the one who's gonna call 911. I'm gonna have you like walk to the door. Hold on, let me get organized here.
Cena safe.
I don't know, I'm gonna steal your pen.
Oh, of course.
All right, let's put a mic down here. This is like doing a set. Ready, action.
Like a rock star.
Let's do takeover. What do they call one? Cut. All right, Brandon.
Okay.
So it's you arrive on the scene of a suspected cardiac arrest.
Okay.
Demonstrate what you're going to do.
Okay. First of all, we arrive. Oh, the scene is safe.
Scene is safe.
Oh, are you okay? Hello. And then we're gonna checking. And then
Hold on.
He's unresponsive. You, Heidi, go call 911 and get me the AED, please.
Perfect.
Okay, and we're gonna check for
Breathing.
breathing. I don't see the chest or anything rising.
Okay.
And so I'm going to begin CPR. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 23, 24, 25, 26, 27.
Put 'em-
28,
okay,
29,
they're
30.
putting the
911's on
speakerphone.
I just completed 30 compressions, and so now I have a mask, and so I'm going to tilt the head back, get my C formation, 1 blow, 2 blow.
Go right into 30 more
Then we're
compressions.
going to go with 30 more compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 24, 25, 26, 27, 28, 29, 30. And then 2 more rescue breaths. Tilt the head back. 1, 2, and now.
Okay, now the Heidi has brought the AED. Unplug that first.
Yeah, so we'll unplug
Yeah,
it really quick.
and then do the pads and then plug it in.
Okay, so we have the pads here. The AED pad's gonna go down here. We'll put this one up top. And then, is that that? So now we're going to turn it on and plug it in.
Analyzing heart rhythm.
Okay. Everyone,
Do not touch the patient.
no one touch the patient. Everyone move.
Shock advised.
All right, shock advised.
Charging.
Everyone stay back.
Stay clear of patient.
It's gonna get real.
Deliver shock now.
All right, gonna deliver the
Press
shock.
orange
Everyone
button
stay back.
Now. Shock delivered.
Shock delivered.
And
We're gonna
go-
begin
go-
CPR.
CPR.
1, 2, 3, 4, 6, 7, 8.
Okay, let's stop there,
10.
Brandon, so we can get through the class.
Perfect.
All right. So now we're gonna have, could you just unplug that defib?
Yep.
And,
Put these back together.
yeah, put those back together.
Yep. Perfect.
And we'll have Heidi do it. I don't know where the other one is. Oh, there. And Brandon, you'll be the one going to
I'll grab the AED.
AED and calling 911 and putting the phone down.
Perfect. Okay. Got it.
I come into the scene, I realize there's somebody down, I look to make sure that the scene is safe. Sir, are you okay? He's unresponsive. You, Brandon, go get an AED and call 911.
You got it.
I look, he's not breathing at all, I'm gonna start CPR. Look for my landmark. 1 and 2 and 3. 3 and 4 and 5
Okay,
and
here, I'm gonna
6
put you
and
on
7,
speakerphone.
8, 9 and 10, 11 and 12 and 13 and 14 and 15 and 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. I'm going to give 2 rescue breaths.
Good,
Continue on.
Yep, do it.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8, 9 and 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Okay, the AED has arrived.
Okay, I'm gonna turn it on.
Yeah. On that one, Heidi, wait till, you, okay, no, you did it right. Never mind, don't listen to the instructor.
Connector next to flashing light.
I know what I'm doing.
You do.
If I don't do it this way, I'll forget.
Apply pads. Plug in analyzing heart
Everyone
rhythm.
stay back, don't touch the person,
Do not touch the patient.
patient.
Shock advised.
Okay, everyone stay clear, do not touch them.
Charging. Stay clear of patient. Deliver shock now.
Everyone
Press the
clear?
orange button. Shock delivered. Begin
1
CPR.
and 2 and 3, 4, 5, 6, 7.
Okay, that's good, Heidi.
All right.
Reset, and we'll have Marie
All right.
do it.
Rock and roll.
Guys are doing good, making the instructor look good here.
That's right.
Where are those? Oh, yeah, I think you need,
Yeah, I got him. Make it look all official, oh yeah. Okay. Oh, this poor guy. Okay. All right, Marie. It's all you.
you can leave the barrier device with,
Okay.
with.
The breathing thing.
Yeah.
So that doesn't come in the AEDs.
Some of them do, some have them, so. Okay, Marie, you're gonna first say what, the scene is,
Scene is safe.
okay?
Sir, are you okay? Are you okay?
Now stop there, what are you gonna do now if he doesn't respond?
Help, I need help. I'm gonna check his chest.
Hold on, you wanna do one more thing after help?
Call 911, and get the fib.
Defib, yeah,
Checking the chest, he's not breathing.
no breathing,
Starting chest compressions.
yeah.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12 and 13 and 14 and 15 and 16 and 17 and 18 and 19 and 20 and 21 and 22, 23 and 24, 25 and 26 and 27 and 28 and 29, 30.
Okay, yep,
Doing the
yep.
chest back. Chest is rising. Back to compressions. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12 and 13 and 14 and 15 and 16 and 17 and 18 and 19 and 20, 21 and 22 and 23 and 24 and 25 and 26 and 27 and 28 and 29 and 30. See.
Okay. Good, you knew to turn
Turning
it
it
around.
on.
Awesome.
Apply pads to patient's bare chest. Plug in pad connector next to flashing light.
Okay, everybody stay clear.
Plug it in now.
Apply pads. Analyzing heart
Now it
rhythm.
is, and what?
Stay
Do
clear.
not touch the patient. Shock advised.
Okay, stay clear, everyone.
Charging. Stay clear of patient.
Clear.
Deliver shock now. Press the shock delivered. Begin CPR.
And 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9.
Okay, Marie, that's good. Excellent. You did a full cycle of adult CPR with the defib. Any questions? Let me tell you, since I've been teaching this for so long, I have had some students who have had to do CPR, okay? The question I get most is, will I be able to do it? And this is what happens, okay? This is from students that have taught lay people, not in the EMS field. They went, holy, you know what? It kicked in. That's why we use these 30 and 2, you know. It's a kind of a teaching tool. It's all right if you do 29 and 2 or 32 and 2. It's a teaching tool to remember. They did their CPR, and then when help arrived, they went, holy, you know what, again, you know. You can do it. I know you will. Adrenaline, everything else will be toned out, and you can do it, okay? Do you have any questions? See, important getting that defib on, and don't get hung up, Marie, on the 10-second rule there.
Okay.
If you go a little longer getting that defib on, that is so much more important.
Yeah.
Yeah.
Do you interrupt compressions to put the AED on when it arrives, or would you let someone else put the AED on?
If there's a second person, we don't interrupt compressions.
They put the
Pads on you, but if by yourself, of course you do. The only time we want to interrupt compressions is actually analyzing and shocking.
I brought over the proposal, and I need for you to tell me what you think.
All right, let's take a look.
If you look at page 2, there's a high-level view of the company. Actually, you know what? I think I have my own copy. Right here. Are you choking? Can I help you?
A business lunch with an associate can turn into something entirely different when he starts choking. Choking in adults is often caused by food blocking the airway. The block in the airway may be mild or severe. If it's mild, the person can make sounds and cough loudly. In this case, stand by and let the person cough. If you're worried about the person's breathing, phone 911. If the block in the airway is severe, the person cannot breathe, talk, or make sounds. The person may also make the choking sign by holding his throat. If this happens, you need to act right away to try to clear the airway. When a person's choking is severe, give thrusts slightly above the belly button. Each thrust pushes air from the lungs like a cough. This can help remove an object blocking the airway. If you think a person might be choking and it's severe, follow these steps. Ask if the person is choking and if you can help.
Are you choking? Can I help you?
If the person nods that he or she is choking and cannot talk, you need to act. You'll need to give thrusts slightly above the belly button. Depending on your size and the size of the person choking, stand firmly or kneel behind the person and wrap your arms around his or her waist so your fists are in front. Make a fist with one hand. Put the thumb side of your fist slightly above the belly button and well below the breastbone. Grasp your fist with your other hand and give quick upward thrusts into the abdomen. Give thrusts until the object is forced out and the person can breathe, cough, or speak, or until he or she becomes unresponsive. An adult who has been given thrust should see a healthcare provider as soon as possible. Let's look one more time at how to make a fist. Make a fist with one hand. Put the thumb side of your fist slightly above the belly button and well below the breastbone. Grasp your fist with your other hand and give quick upward thrusts into the abdomen. If the choking is severe and the person is pregnant or very large, put your arms under the person's armpits and your hands on the lower half of the breastbone. Pull straight back to give chest thrusts instead of abdominal thrusts. If you give someone thrusts but cannot remove the object blocking the airway, the person will become unresponsive. Watch and see how this might happen and what you should do.
Sir, can you help me lower him to the ground? Phone 911 and get in the AED.
When a choking adult becomes unresponsive, shout for help. Phone or have someone else phone 911 and get an AED. Put the phone on speaker mode so that you can talk to the dispatcher. Provide CPR, starting with compressions. After 30 compressions, open the airway and look in the mouth. If you see an object in the mouth, take it out. But do not perform a blind finger sweep, because the object may become lodged further back in the airway. Each time you open the airway to give breaths, look for the object in the back of the throat. After checking the mouth, give 2 breaths and then repeat 30 compressions. Continue CPR until the person speaks, breathes, or moves, or until someone with more advanced training arrives and takes over.
All right. So the Heimlich maneuver, I've never seen it not work, and I've never seen someone who's choking go unconscious and you have to do CPR. It's incredibly successful. What it's doing is taking air from your diaphragm and forcing it up the trachea and out. And it's so easy to do. And like I said, you'd come across choking more than you would a cardiac arrest. So here's my question that Heidi probably remembers from past class, but we'll see. What age group is the most common to choke? What do you think?
Adults who are drinking and eating.
You've had my class. Oh, well, you've taken. All right. He cheated. I usually get infants or elderly, okay? It's middle-aged men. Middle-aged men eating large pieces of meat and alcohol's involved, okay?
And they go to the restroom because they're embarrassed.
Yep, they go to the restroom. So what happens with choking is you have your trachea, which is your airway, and your esophagus, which is your food down to your stomach. Above that is the epiglottis, okay? It works involuntarily, shuts, when we're eating, it covers the trachea, okay? Alcohol kind of doesn't make that work as well, okay? So usually it's middle-aged men choking on big pieces of meat, okay? So now we're going to come up around here. We're going to show you how to do the Heimlich on each other.
I was in that situation once, and I knew I was hoping people thought I was kidding, and I ran over to like a sink and did it to myself and coughed it up. I was freaking out.
Yeah.
I was like freaking out because I was like telling a story. People thought I was being funny because we were.
Could you not speak, or
I couldn't get air in or out.
That must be a pain.
It was like I was freaking out. I knew I was about to like pass out.
Because I choked. They show in the movie you're supposed to do this. To me, if you're not breathing, and then people thought, and then I think after like a few seconds, my wife started crying. But then I went over to the sink because no one was helping me, and so I ran into like the kitchen and hit myself as hard as I could in the stomach and leaned over the sink and coughed it up. So, okay, to do the Heimlich, we do want to ask the person, can you speak? Because sometimes, you'll get what I call that piece of food in no man's land where and some people say, I'm choking. Well, they're speaking, they're not choking, okay? And we don't want to do the Heimlich because by moving them around, it could cause them to choke. So in that case, let them keep coughing.
And watching them.
Watching them, yep. So, I need a victim. All right, Heidi. So Heidi, I would go, can you speak? No. I know the Heimlich maneuver, okay? What I'm going to do is get behind Heidi, and I want to get one leg in between her legs. That's so she passes out, I can kind of get her to the ground, okay? So what I do is, I like to feel for the belly button, and I go right above it. And you saw in the movie how you made your fist? Belly button, right above it. I'm not really going to do this because it did. And I would go as hard as I can, inward and upward. And that thing's going to come right out. Okay? And like you said, a pregnant woman, we wouldn't do that on. We'd do it in between the breasts by going underneath their armpits. Or someone who's obese, you can't get around, get around there. Okay? So you want to try it on?
So do they teach anymore, like if it's a real obese person who's sitting in a chair, you don't lie them down and do that?
Not anymore, no.
Okay.
And they won't sit in a chair if someone is choking.
They're freaking.
They're freaking. So. Yeah. So.
You want to try?
Sure. Okay. Are you choking?
Can you speak?
Can you speak?
So one leg, yep. And make your fist, and you're right above her belly button, and you go in and upward as hard as you can. Even doing a little bit, Heidi's feeling something.
Yeah, you can feel it.
Okay. Now Heidi, you can do it, Marie.
Are you okay? Are you okay? Can you speak? Are you choking?
Brandon can do it to one of you, or?
Thank you.
Heidi's
Are you okay? Can I help you? I know the Heimlich maneuver.
She's had a few drinks.
That's right.
But when I've done it, I've never done it more than twice, and it's come out.
It really, if you're
It was
doing
super
it forcefully, wow.
Can you do it too hard?
No, because you want to get hurt.
Yeah.
That's why, you can do some damage. I like if someone's choking, I want someone calling 911.
That's right.
Because I want an ambulance coming.
Even if they clear it and everything,
Right.
just in
Yeah, you
case.
can do some damage, and you could do, the one I had at a restaurant, because she couldn't breathe, she bit her lip like because you're panicking, I guess. So her lip was just bleeding and all. Yeah.
It's terrifying to see.
Yeah.
Yeah.
That's crazy.
Okay, so let's say they went unconscious. What would you do next, Heidi? You've done the Heimlich, and for some reason.
And you slide them down if you can.
And now I want you to go into CPR,
Right.
Do it.
Okay, call 911.
Yeah.
You know.
And the
And
seat
then
is
I would
already
just-
safe. Right?
Yeah,
we already know that.
Yeah, seat is safe, and I would just go right into CPR. 1,
Yeah.
2, and 3, and 4, and 5, and 6, and 7, and 8. And then when I get to 30, I would do this.
Do two breaths
Do 2 breaths.
first.
But do I look for anything?
No, after the 2 breaths.
Oh, 1 and 2.
And now just look, but never stick your fingers in even an unconscious person's mouth, because they may bite, and it'd be a nasty bite. And we got the defib ready.
Except they said unless you can see it though, right?
Right.
If you
That's
can
right.
You can see it.
We used to teach this thing called a blind finger sweep.
I
where you
remember
go
that.
in-
Remember that?
Yeah.
Remember that?
No, if they're half conscious,
Not just that.
I don't even, I teach this, but to me, take a quick look. I wouldn't get, because we're also, believe it or not, by doing CPR, we're doing a modified Heimlich too. Because we're getting some air here, like
That's right.
compressions.
And breathing into them, I mean, if there's something lodged,
You may
you're
push
You
not,
may not,
Yeah.
you can
I mean,
try,
I
but
mean-
you may not get.
You won't get air in there. That's why you'll know it's still
in
so
there.
So let's, Marie, you try it now. You've done the Heimlich and they're passed out.
Okay,
And so yell, we know the scene's safe, yell
all right.
for
Call
911.
911, get an AED.
Okay, go right into your CPR.
1 and 2 and 3 and 4 and 5 and 6 and 7.
Okay, now we'll say we're at 28, 29. Okay, now do your airway. Do that C. 1 breath, 2 breath. Now just take a look. See if you can see and go right into CPR.
1 and 2 and 3 and 4 and 5 and 6.
Okay, good.
So I'm dropping him down. The seat
Yeah.
is safe. Oh my gosh, are you okay? He's unconscious. Call 911.
Okay.
Grab an AED.
We'll say you're at 28,
30.
29, 30.
Then we're gonna go into the 2 compression. Well, first of all, I'm gonna see if I can see anything.
Yeah, actually, you do that after the breath.
After breath, okay. So we're gonna do the breath first. 1, 2.
Look for.
I don't see anything, so I'm gonna continue. 1, 2.
Okay, good.
Perfect.
Okay. I didn't have my microphone down there, I just realized, but maybe I talked too loud. Any questions on the Heimlich? Okay. It's very important, easy to do. Okay.
If you're doing the Heimlich, should you have somebody call 911?
Oh yeah, I like to. In the movie, they say I like any medical emergency. I don't care what. A lot of times we're going, and then we get there, you don't need us, which is fine. You want help coming.
Yeah, in case it doesn't, I mean, because you
Right.
don't know if it's going to work.
Right, exactly. I'm a big proponent of 911 right away. So, all right, we're gonna move to the infant CPR, and thanks, Brandon's gonna even have an infant. Look at that, that's perfect. Okay, in CPR, our world, an infant is considered birth to age 1. Okay. I think I'll let you watch the video, and then we'll go from there.
When did Timothy's mom say she was coming back?
Well, she's swimming laps in the pool now.
So half hour?
That'd be about right. Okay, guys, let's share. Let's share. All right. That looks like fun.
Timothy?
Sherry, what's wrong?
There's something wrong with Timothy. He doesn't look right. What do I do? What do I do?
I remember from CPR class.
There is nothing more frightening than when something happens to an infant. But with the training you received today, you'll have the skills you need in emergency situations like the one you just saw. Hello and welcome to the infant CPR portion of the American Heart Association's Heart Saver CPR AED course. This course will help you learn in several ways. Your student workbook covers all the material and includes quick reference guides. And this video will give you facts and show you important skills. If you complete all the course requirements and demonstrate these skills correctly, you'll receive a course completion card. Studies show that you need to review this information and practice these skills frequently to maintain your ability to respond to a cardiac arrest. Now, let's get back to the Child Care Center and see how training in CPR can help you save a life.
Oh, okay, let me have him. Timothy? 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 Sherry, phone 911. Trey, get the first aid kit. Lisa, would you move the kids to another area, please? And find Timothy's mom. Okay.
We have a baby that is unresponsive.
He's not breathing.
No, we don't have an AED.
1, 2,
The address
3.
is 149 Barnard Street. Yeah, I can meet them up front and bring them back here. Okay, I'll do that. Brenda, I have dispatcher. She asked me to put the phone on speaker mode here beside you. I'm gonna go wait outside for paramedics.
30. Come on, breathe. 1, 2, 3,
I'll take over
4,
compressions on the
5,
next set.
6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Timothy, what happened?
Okay, I'm taking over compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9,
That's good.
10,
How old
11,
is the infant?
12, 13, 14,
6
15,
months.
16, 17, 18, 19,
We phoned
20,
911.
21,
The paramedics
22,
are on the
23,
way.
24, 25, 26, 27, 28, 29, 30.
Can you tell me what happened? We don't know. He was fine 1 minute and the next
2,
minute he wasn't
3,
moving.
4, 5, 6, 7,
His mother's
8,
here.
9,
Does
10,
Timothy have
11,
any medical
12,
issues?
13, 14, 15,
No,
16,
not that I'm
17,
aware of.
18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11,
Remember to
12,
push hard and
13,
fast.
14, 15,
About an inch and a
16,
half.
17, 18, 19,
Nothing like this
20,
has ever happened
21,
before.
22,
He was fine when he
23,
came
24,
in.
25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5.
Just as in older children, when an infant's heart stops beating, blood stops flowing through the body. When you push on the chest, you pump blood to the brain and heart. For the purposes of this course, an infant is younger than 1 year. Because infants are so small, there are some differences between infants, children, and adults in how CPR is performed. When providing compressions to an infant, you use just 2 fingers of one hand versus 1 or 2 hands for a child and 2 hands for an adult. Also for an infant, you should push down about 1.5 inches at the rate of 100 to 120 compressions per minute. To provide high-quality CPR, you do 4 things. Provide compressions that are deep enough, provide compressions that are fast enough, allow the chest to return to its normal position after each compression, and don't interrupt compressions for more than 10 seconds. In providing high-quality CPR, pushing hard and fast when providing compressions is just as important with infants as it is with children and adults. Make sure the infant is lying on his back on a firm, flat surface. If possible, use a surface above the ground. Move clothes out of the way to bare the chest. One of the main differences in infant CPR is that you use just 2 fingers in providing compressions. Watch this for placement of your fingers on the baby's chest. Put 2 fingers of one hand on the breastbone, just below the nipple line. Let's look at placement of your hand again. 2 fingers go on the breastbone, just below the nipple line. Press the infant's chest straight down about 1.5 inches. After each compression, let the chest come back up to its normal position. You'll need to give compressions at the rate of 100 to 120 compressions per minute.
Marie, why don't you come up? We're just going to practice compressions here on the infant. And what we want is, again, we use the nipple line as our reference. And I want to be just right below it. So I kind of draw a line there. And that's right there. So see how you do it. And now just do some compressions. Yep. And do the same 30 like a good rhythm.
Okay. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10, 11 and 12, 13 and 14 and 15 and 16 and 17 and 18 and 19 and 20 and 21 and 22, 23, 24, 25, 26 and 27 and 28, 29, 30.
Good. Okay, now we'll have Heidi come up.
And why is it so important to have the infant on a table versus the floor?
See the leverage I got? It's kind of like when I'm on the adult.
Okay.
If I'm down here, it's just not comfortable.
It's more awkward. Okay.
Yeah, it's easier. Yeah.
Okay, so nipple line right below it. 1 and 2 and 3 and 4, 5, 6, 7, 8, 9, and 10, 11, 12, 13, and 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Good. Okay, now Brandon's going to do it.
So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30.
Good. All right. So it's very simple, nipple line. Can never go wrong. That's why I love using that as my landmark, you know. I don't know, those of you remember years ago, you did 2 fingers down here and you went like this. Yeah.
Yeah.
It was,
Infants often have healthy hearts. Usually when an infant's heart stops beating, it's because he can't breathe or has trouble breathing. Therefore, it's very important to give breaths as well as compressions to an infant who needs CPR. When giving a breath, opening the airway correctly will help keep an infant's tongue out of the way. Opening the infant's airway too far can actually close the infant's airway, making it difficult to get air inside. Follow the techniques you're about to learn to make sure you open the infant's airway correctly. So let's look at the steps for opening the airway and giving breaths to an infant. And remember, this should be done quickly during CPR, never interrupting chest compressions for more than 10 seconds. We'll show you how first, and then you'll get a chance to practice. Because you will always be giving breaths after compressions, begin with 2 fingers of one hand on the mannequin's chest. To open the airway, follow these steps. Tilt the infant's head back by pushing back on the forehead, and put the fingers of your other hand on the bony part of the chin and lift. It's important to avoid pressing into the soft part of the neck or under the chin because this might block the airway. Also, don't push the head back too far. This might close the airway as well. While holding the airway open, take a normal breath. Cover the infant's mouth and nose with your mouth. Give 2 breaths. Blow for 1 second for each. As you give each breath, you should look down at the infant's chest to see it rise. Infants don't need as much air to make the chest rise, but you'll only know the infant has gotten enough air if you do see the chest rise. After giving the breath, go back to the position to provide compressions. Let's watch one more time. Tilt the infant's head by pushing back on the forehead and put the fingers of your other hand on the bony part of the chin and lift. While holding the airway open, take a normal breath. Cover the infant's mouth and nose with your mouth. Give 2 breaths. Blow for 1 second for each. Watch for the chest to rise. After giving the breath, go back to the position to provide compressions. If you have difficulty making an effective seal, try either mouth-to-mouth or mouth-to-nose breaths. If you use the mouth-to-mouth technique, pinch the nose closed. If you use the mouth-to-nose technique, close the mouth. Sometimes you'll find that your breaths aren't making the infant's chest rise. If you give a breath and the chest doesn't rise, quickly reopen the airway by allowing the head to go back to the normal position, and then open the airway again. Give another breath and make sure the chest rises this time, interrupting compressions for no more than 10 seconds total. If the chest doesn't rise, begin pushing hard and fast on the chest again. Remember, in giving effective breaths, it's important to minimize interruptions in compressions. You should give the 2 breaths in 10 seconds or less, and remember to blow for 1 second. You may give breaths with or without a mask. If you're in the workplace, your employer may provide personal protective equipment, including pocket masks for use during CPR. Masks are made of firm plastic and fit over the infant's mouth and nose. There are many different kinds of masks and face shields, and there are different sizes for adults, children, and infants, so make sure you're using the right size. You may need to put a mask together before you use it, but this is usually as simple as popping it into shape and attaching the one-way valve that goes with the mask. That's the part you breathe into. Your instructor may also discuss other types of devices that can be used when providing breaths. So, let's take a look at how to give breaths with a mask. We're going to show you a demonstration on how to place the mask and give breaths. Afterward, we'll give you a chance to practice giving breaths with a mask. We'll start next to the mannequin, with your fingers in place to provide compressions. Put the mask over the mannequin's mouth and nose. If the mask has a narrow or pointed end, put the narrow part of the mask on the bridge of the nose. The wide part of the mask should cover the mannequin's mouth. Tilt the head and lift the chin while pressing the mask against the mannequin's face. It's important to make a good seal between the mannequin's face and the mask while you lift the chin to keep the airway open. Now that you've got the mask positioned, give 2 breaths while watching for the chest to rise. Actually seeing the chest begin to rise is the best way to know that your breaths are effective. After giving the breath, go back to the position to provide compressions. Remember, if the chest doesn't rise after you give a breath, tilt the head back and lift the chin and try again. You should try to give 2 effective breaths within 10 seconds.
Okay. I think with infants, mouth-to-mouth is very important, okay, because it's usually respiratory, okay? On the video, they say you can do mouth-to-mouth with either mouth-to-nose or no. I like teaching you on an infant because they're so small, you put your mouth over the nose and the mouth, okay? And this mannequin's a little old, so it goes back a little bit farther than a real baby would. But to open an airway, I like 2 fingers on the bony part of the chin and just lightly go back, okay? And what I like if I was doing mouth to mouth, you see I'd be over the nose and mouth. I was always taught puffs of air, and puffs of air was like enough air in your cheeks and blow, okay? So I do that and looking at the chest, puffs of air, okay? The pocket thing, same thing, just tilt the head back and puffs of air. So why don't, Marie, you come up and we'll demonstrate opening the airway. This baby goes back way too far because it's had so much use. So to open an airway, just put, and lightly go back, just like perfect, okay? Now if you were doing mouth to mouth, you'd go over the nose and mouth, and you do puffs of air and let the chest rise. Okay, if you're doing a mask, remember how I taught you to hold the mask? Right. Yeah, and just push, yes. Has good opening the airway. Okay.
And if the first breath doesn't cause the chest to rise, do you do 2 more or just 1 more?
You reposition the head, like let it go back to the normal spot, and try to open it again. And I try to get 2 in.
2 in.
Yeah.
Okay.
You know. Okay. So Heidi.
It's just a gentle lift.
Yeah.
Like that.
Yep.
Puffs like this.
Perfect. Good.
Yeah, so we're doing just a gentle lift.
Yeah.
Get to neutral there.
You guys are doing a great job opening the infant's airway. You're nice and gentle.
2.
You get some big firefighters say,
Yeah, 'cause
great.
Like, baby's like neutral, and like
Yeah.
it's like this, and then
Yeah.
it's just like that, right?
yeah. All right. We're going to be getting ready to put this all together.
Now we're going to demonstrate how to put it all together, from scene safety and assessment to providing compressions and giving breaths. Afterwards, you'll get a chance to practice. First, check to make sure the scene is safe. The scene is safe. Make sure the infant is lying on his back on a firm, flat surface. If possible, use a surface above the ground. Tap the infant's foot and shout to see if the infant is responsive. Baby, baby, are you okay? Are you okay? If the infant is unresponsive, shout for help. Help! Help! Somebody help! If help is nearby, have someone phone 911 and get an AED. You, phone 911 and get an AED. Check for breathing for at least 5 seconds, but no more than 10 seconds. If the infant isn't breathing or is only gasping, he needs CPR. Move the clothes out of the way to bare the chest and begin chest compressions. Now, place the mask and open the airway and give 2 breaths. Watch for the chest to rise. Repeat. Now, place the mask and open the airway and give 2 breaths. Watch for the chest to rise.
What I forgot to mention was when you know how we say you're okay to a human. Well, baby can't say, hey, I'm fine or I'm not. I mean, you can say I like clapping around, making noise, picking their feet. Okay, I want to get them to cry. And unfortunately, a baby who's in cardiac arrest is just a limp doll. So that's when I want to call 911, get a defibrillator, okay? Then we're going to go right in. We're going to check for any breathing, looking. Then we're going to go right into 30 compressions. 1, 2, and 3, and 4, and 5, and 6, and 7, and 8, and 9, and 10, 12, and 13, and 14, and 15, and 16, and 17, 18, and 19, and 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, and I wasn't prepared. One breath, 2 breaths. That's okay. All right, we ready to do it all together? I'll take your skill sheets for infant. So we're going to do the same thing. You're going to walk in. Oh, let me see. What's it say? While you were pushing a baby in a stroller in the park, you noticed something is wrong with the baby. You do not have a phone nearby. You ensure the scene is safe and take the baby out of the stroller, demonstrate what you do next. So we know the scene is safe, the baby's in a stroller not breathing, you take it out, obviously you either put it on the ground, a park bench, or a picnic table, okay? So now what would you do, Marie? What are we gonna do? Check for?
To see if the baby's breathing and.
Yeah, do that.
You okay? Okay, baby's
No,
not.
okay, I'm supposed to say there's no one here to help, so you're on your own.
Oh, okay.
So this brings me in, this is a good actually, with children and infants, they want you to do a couple sets of CPR before you go to get help. The reason why that is it's usually respiratory with children and infants, and they don't want you to waste any time, okay? That's the Heart Association's thing. I'm a big proponent, I want help coming. If I can get help coming, I want to do that first, but they want you for children and infants to do a couple sets of CPR. So, okay, no one is around to help. So, okay, we're going to start your compressions.
So baby's.
You look to see there's no breathing.
Baby's not breathing, starting chest compressions.
Yeah, go.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12 and 13 and 14 and 15 and 16 and 17 and 18 and 19 and 20 and 21 and 22, 23 and 24 and 25 and 26 and 27 and 28 and 29, 30.
Do you breathe in? Go and do another round of, okay, I'm sorry,
Oh.
you didn't see the second round. That's all right. Go into CPR.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12 and 13 and 14 and 15 and 16 and 17 and 18 and 19, 20 and 21 and 22 and 23 and 24 and 25 and 26, 27 and 28 and 29, 30.
Okay, 2 breaths. Okay, I'm going to stop you there, and now let's say you were alone. Now you need to find a phone or something, okay?
Right.
Okay. All right, that's good. Heidi Harper. Same thing, it's the same scenario. You're in the park, yeah.
So I've gotten the baby onto a park bench or something, and I'm like, baby, are you okay? Unresponsive. I check for breathing. I don't see any breathing, so I'm going to start CPR right away. 1 and 2 and 3 and 4 and 5 and 6 and 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One and 2 and 3 and 4 and 5 and 6 and 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Okay. Technically, you do a third cycle, but we're running on the time now. So
Okay.
now you go get help.
And then you go get
Okay, yep, ready.
Pushing the stroller through the park. Notice baby's unconscious. Move baby maybe to a picnic table. Baby, are you okay? All right, no crying, he's unconscious. No one's around to help, so I can't ask for help. So I'm going to begin a couple cycles of CPR. 1, 2, 3, 4, 5, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. I don't have a mask for this round, so I'm just going to go.
Okay, yeah, you do the nose and mouth.
2, 1, 2, 3, 4, 5, 7, 8, 9, 10, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. Hey, I found a mask. To the headband. 1, 2. Now we do
Okay,
it.
let's say you've completed sets of 30 compressions, now you go get help.
Then we find a way to go get help.
Good. Awesome, awesome. So just so you know, this is an older man again. You wouldn't go down, on a reel, you wouldn't go down that far. This has a lot of miles on it, this Mannequin, so, you know, especially, yeah, a baby, you're right.
Yeah.
Yeah.
Oh, my goodness, that'd be terrible. I can't imagine.
It's horrible. I've done it once, and it's still in my mind, and that was 1998. Yeah. So, any questions? Let me see what the video does next. Does it do choking or?
Choking is also a common emergency with infants. When an infant has severe choking, you need to act quickly. You'll use a combination of back slaps and chest thrusts to help remove the object blocking the airway. Hold the infant face down on your forearm. Support the infant's head and jaw with your hand. Give up to 5 back slaps with the heel of your other hand between the infant's shoulder blades. If the object does not come out after 5 back slaps, turn the infant on his back, supporting his head. Give up to 5 chest thrusts using 2 fingers of your other hand to push on the chest in the same place you push during CPR. Repeat giving 5 back slaps and 5 chest thrusts until the infant can breathe, cough, or cry, or until he becomes unresponsive. If the infant becomes unresponsive, do the following. Place the infant face up onto a firm, flat surface, then shout for help. If someone comes to help, have that person phone 911 and get an AED. If you're alone and you have a cell phone, phone 911 and put it on speaker mode. Provide chest compressions in the same place as you would for CPR. After 30 compressions, open the airway and look in the mouth. If you see an object in the mouth, take it out. Give 2 breaths. Each time you give breaths, check the mouth for an object and remove it if you see it. Repeat giving sets of 30 compressions and 2 breaths. After 5 sets of 30 compressions and 2 breaths, if no one has come to help and you do not have a cell phone, then take the infant with you and phone 911 and get an AED. Use the AED as soon as it is available. Keep providing 30 compressions and 2 breaths, checking the mouth for an object after each set of compressions until the object comes out, the infant starts to respond, or someone with more advanced training arrives and takes over. Give only back slaps and chest thrusts to an infant. Giving thrusts to the abdomen of an infant could cause serious harm. Any infant who has been given back slaps and chest thrusts should be seen by a healthcare provider as soon as possible.
Okay, you know what I messed up on and is, remember when we look into the mouth to see if an object, I had you doing it after the breaths. I guess they want it done before the breaths. So, with infant choking, best to sit in a chair because easier, and you can use gravity, okay? So an infant, I want to sit in a chair, and most important, I want to cradle the head. And I want to make sure I'm not covering his mouth and nose. See how I have my fingers? I lay out my thighs. See now, I got gravity working for me to get an object out. And right in the center of the shoulder blades, I do 5 back blows. 1, 2, 3, 4, 5. I flip the baby over to by cradling that head, go to my other leg, and I do 5 CPR compressions, okay? 1, 2, 3, 4, 5, okay? This is for a infant you saw was conscious and you saw choking, so they were conscious for a while. If this doesn't work and the baby goes unconscious, we're gonna go into CPR mode, okay? Any questions?
So the positioning of the head when the baby's face down is kind of a neutral?
Yes, neutral, yeah. I'm just making sure I'm cradling it good because it will want to go all the way back, which isn't good. And when I'm on this side, I just want to make sure I'm not like doing this. You know, I want to, so. You want to try, Marie?
Am I doing the whole thing or just?
No, just in the chair. You know this patient. So turn the baby over. We do back blows first. Yep. And sit right in the middle of the shoulder blades, which is right about there. No, that's.
Oh, I'm sorry.
Yep. Go harder. Yep, real good.
That's going to be the challenge for me to like do it, know how hard to do it.
I'd give it a good punch because we want that object coming out. Yep, like that. Flip the baby over.
1, 2, 3, 4, 5.
And then you'd keep doing that.
And then would I check?
Not here, no.
Not in this. Okay.
That's unless we go into CPR mode.
Okay.
Okay, good. We'll let Heidi have a shot here.
I love the tattoo on that baby.
Yeah, what's it say? Oh, yeah.
Very rebellious.
The baby's here, whatever. I get the baby and I'll cradle and I'll do a 1, 2, 3, 4, 5, and I'll turn the baby over.
See, that object's coming out with those back
Oh, yeah.
blows.
Oh, yeah.
That's why you need to be firm.
Yeah. I guess you can't really hurt the baby from the back.
No, it's pretty strong right there, yeah.
Right.
Yeah.
So got the baby here, support.
And the leg, they're gonna be floppy. So
Yeah.
you're gonna be able to hang on to them.
Yeah,
easy.
better than
Oh,
that.
absolutely.
Yeah, that's a good point.
1, 2, 3, 5. And that's our big baby. But yeah.
Yeah, that's true.
Good.
Here we go.
So again, infants can sometimes be choking, especially with food. If the food isn't good or they get something in the crib. So some defibrillators have what we call pediatric pads. Like in Wellesley here, the elementary schools have pediatric pads. But we're considering in defib world, 8 and above, you use adult pads. And worst case scenario, you always go the higher, so. But on an infant, there's 2 ways to do an infant and a child, okay? So these are my pediatric pads. They have, where I'm gonna place them for an infant is front to back. If I had a child who's bigger, I'd do it like I would, okay? The others, so.
Apply pads to patient's bare chest. Plug in pads connector.
I brought the wrong one. Hold on. Be prepared for class. The one I was showing you was for my other trainer. All of a sudden I go, that doesn't fit in there, so. Get set up here. Good thing these are training pads. There. Okay, now I'm ready.
Apply pads to patient's bare chest. Plug in pads analyzing heart rhythm. Apply pad.
See, my other machine. Yeah, I know. Come on, Paul. What are you doing? You should know this stuff. I got brand new pads too. Now I gotcha.
Apply pads to patient's bare chest. Plug in pads connector, analyzing heart rhythm. Do not touch the patient. Shock advised. Charging. Stay clear of patient.
Everyone clear, clear.
Deliver shock now. Press the shock delivered. Begin CPR.
And I'd go right into CPR, and it's all right doing it over the pad, okay? You don't have to be tested on infant defib. It's only recently that we started doing infant. But if I had a bigger, like, this is like a 5-year-old. The difference in these pads and the adult pads is there's it reduces the amount of electricity. But let's say this is my 5-year-old who's in pretty tough shape. I would go just like, an adult, okay? So, and whenever in doubt, I mean, worst case scenario, you can put adult pads on children, and you always do adult pads. You do even the child, because they're so big front to back.
If it's an adult pad on a child,
Yeah,
you'll do front to back.
because there's just not enough room.
Okay,
Yeah, so.
okay.
And so, Paul,
Yeah.
I mean, there are going to be lots of cases where you wouldn't know if the child is 8 or not, right?
That's why
so are
you
you going by size?
Size, yeah.
Okay.
It's really weight too. Not so much weight because an elderly person. It's size, and whenever in doubt, go to the higher level.
Okay.
Yeah. So I know we're running short on time, but I just want to show you a quick thing on child CPR, which is age 1 to age 8. If we have time, let me.
You've learned how to assess the need for CPR and phone 911. Now let's focus on compressions and how they should be done. It's no different than with adults. CPR for a child, pushing hard and fast on the chest, is the most important skill you'll learn. To provide high-quality CPR, you do 4 things. Provide compressions that are deep enough, provide compressions that are fast enough, allow the chest to return to its normal position after each compression, and don't interrupt compressions for more than 10 seconds. Chest compression is the act of pushing on the chest. When you push on the chest, you pump blood to the brain and heart. When providing compressions on a child, use one hand for compressions. If you can't push down about 2 inches with one hand, use 2 hands to compress the chest. Sometimes people don't push hard enough during child CPR because they don't want to hurt the child. However, it's better to push too hard than not hard enough. Let's watch this demonstration and then you'll get to practice. Make sure that the child is lying face up on a firm, flat surface. Position yourself at the child's side. Move the clothes out of the way to bare the chest. Use one hand for compressions. If you can't push down about 2 inches with one hand, use 2 hands to compress the chest. Put the heel of one hand on the lower half of the breastbone. If you are using 2 hands, put the heel of your other hand on top of your first hand. After each compression, let the chest come back up to its normal position. Compress the chest 30 times at a rate of 100 to 120 compressions per minute.
And again, it's the 30 compressions, 2 breaths. We're about.
It's going to depend on your size, too, because if you're not as strong. Or not
Right. You got a small, 100-pound someone, you need 2 hands. That's why they've really gotten away from strict push harder. We're about ready to wrap up.
Can I ask you a question?
You certainly can.
Adult CPR. So for a woman wearing a bra, you
Oh,
wearing
good
a bra?
question. Okay, so
Cut it, right?
If you don't have scissors.
No scissors.
what I've done with a woman because Irish Catholic and have, I've left the bra on when I'm doing CPR. You can do CPR. But to do the defib, it's got to come off, okay? And I'll tell you another common question we get, big-breasted woman. What do you do? Just move them out of the way, So, yeah, I keep the bra on, especially if we're out. In the ambulance, it's coming off, But to defib, we need everything off. And some of them can be a wire bra, so that could affect, too, the defib, the electricity. So, yeah, that's a great question, though.
But you're looking for landmarks.
Yeah, because you're looking for
So
landmarks.
if the bra is on and it's a small-chested woman.
You got a perfect
it's okay.
landmark.
You got a landmark. You got a gigantic woman. Maybe, pull it up or something.
Yeah, pull it
so
up.
You can see the landmark.
Right. You do whatever you can. So, yep. That's
Yeah, that's a good
great question. Okay, we're going to wrap up. So, first of all, any overall questions?
So all the AEDs in Wellesley,
We buy Life Pack by Physio Control.
they're going to have an infant, a child,
No.
and an adult. Just tell me.
Just an adult. In most, only time,
in the schools.
schools or daycare, anywhere where they know they got minor children.
Okay.
I'm going to look at the one like at Roach Brothers, the supermarket, to see what they got in there.
They sometimes have the
Yeah.
child.
See, yeah.
Just curious.
Yeah, that's a good idea, but most don't,
Okay.
because you're talking adult, yeah. Yeah.
And I need to get pediatric pads for this one.
And see, it's all, and they're like, I think, $100 and something dollars. Yeah, I mean the pads alone. Yeah, oh yeah. Do you know when I first used a defib was during the remember it's April 1st blizzard snowstorm? Our defibs were the size of a suitcase. And they were like $18,000 then. We had two of them. And that's when I did a defib. A guy snowblowing had a heart attack, and I did it in the driveway, yeah. But they were big things. They're, massive. So.
Paul, so when you have, a 5-year-old, you're doing front to back with the adult pads.
Yeah.
But if it's a really big kid, would you do adult placement?
If they fit and they're not touching each other, the big thing, we don't want the pads touching each other.
Okay.
Yeah, yeah. So you're going to be certified in adult CPR and infant CPR. We ran out of time to actually certify in child, but if you can do adult CPR, you can do child CPR, okay? I can't thank you enough for letting me do this. And let me tell you how you get your cards. Tomorrow when I'm at the fire station, I'll put your emails in the computer, and usually it's like 2 days. But I forgot to bring the sheet. But you're going to get an email that says, do not reply one, that says AHA for AmericanHeartAssociation.org. Okay? You're going to click on it. It's not us. And it's going to, you're going to have to register with the Heart Association. It takes like a minute. And then you get to review me. My name will come up. And then you hit a button, there's your card, and you can print it out. It's good for 2 years. So I hope the class was helpful. I can't thank you enough for letting me do this to get my teaching certificate. I really appreciate it, and I hope I didn't bore you.
No, this was good. So helpful.
great.
This is great.
Good,
Yeah,
good.
really.
Awesome. All right. Well, thank you very much. I'm here picking up if you got any questions. Thanks again for Rec helping out. Yeah. Yeah, I need those skill sheets. Yeah. You keep the books.